Okay, so our final discussion on the vertebrum, or the back, if you will, or the spinal column, however you want to term it, we'll really discuss two of the areas that are actually fused bones. The sacrum being 5 fused bones, and then the coccyx being 3 to 4 fused bones, sometimes 5, depending. There is some variability there. So we're going to first discuss the sacrum, and first we need to probably identify which direction is anterior and posterior. And it's quite easy to do, because if we think about posterior, what term is also analogous with posterior for the most part with us, and that's dorsal. So our dorsal fins kind of come out here on the sacrum, indicating that this is the posterior aspect, or the dorsal surface, or the spiny surface, if you will, of the sacrum. That leaves this to then be our anterior surface, or we can also call this the pelvic surface, because this is what's ultimately going to form the posterior wall of our pelvic cavity. We can identify really a separate bone. You can see this little ridge if I zoom in here, and this kind of looks like a vertebral body from the lumbar spine. It's just now been fused with some of the other vertebral bodies of the sacrum. So you can see the fusion lines running in between each one of these sacral vertebrae. So this here we'd consider the body then of the first sacral vertebrae. Some other areas that we're going to really want to pay attention to is the wings. So again, I'm looking at the anterior surface here. So we call this the wing, or the ala, A-L-A, the wing or the ala of the sacrum. We also have some articulating surfaces, and these are rather large. This is on the lateral aspect of the sacrum, and if you look at it, it's actually kind of shaped a little bit like an ear. So this is our auricular surface, or auricular surface of the sacrum. It's ultimately going to articulate with the pelvis. If we look back to the dorsal aspect, or posterior aspect of the sacrum, our most superior facets here, this is our superior facets that are going to articulate with the inferior facets of L5. So here they are here. We can also see some crests developing. So we have a lateral crest developing here. We have a intermediate crest developing right here. And then we have what's called not the medial, but the median, meaning right down the middle, our median sacral crest. And those really are analogous to the spinous processes that we saw in other areas of the vertebrae. We also can identify a canal, and it's not been hollowed out, but this little area here would be where the nerve roots would continue to pass through. So this is a superior to inferior view, and you can see the sacral canal forming right there. Now, if we go back to our posterior view, we can see little openings here. We could consider these our posterior foramen. And then if we turn to the anterior surface, we can identify now the anterior foramen of the sacrum. So we're going to have key neurovascular structures, or primarily neural structures, exiting from this particular openings. Some other openings that we want to be able to identify are this little opening right here we call the sacral hiatus. So just a little opening. right there on the most posterior aspect of the sacrum. We also have the, right at the bottom of this would be almost like horn-like structures that you can see. We call these the sacrocornu, cornu being analogous to horns. So you can see these horns forming right there as well. So that about wraps up the sacrum, and we'll look at the coccyx as well. And I'm just reminded here, I think I forgot to show you guys this when I discussed the vertebral body. When you look a little bit closer into this vertebral body, you can see how it juts out. It's really prominent, right? So if you think about the most prominent portion of the sacrum, it's this aspect, and we call that area the sacral promontory. So that's another important area, and that's going to be ultimately an articulation between the fifth vertebrae disc and the vertebral body of the first sacral vertebrum. Okay, so let's look at the coccyx. The coccyx would be articulating on the most inferior aspect of the sacrum here. And it's, like I said, it can be 3 to 5 fused bones, and it has a little bit of an angulation from posterior to anterior here. So really I just want you to be able to identify the bodies of the first and the second through potentially the fourth fused vertebrae. And you can see some transverse processes emerging from these as well, significant with the other vertebrae that we have already talked about.